It's one of the most common respiratory problems in the country, especially here in the South. COPD. What does it stand for? What does it mean? Joining us is Dr. David Handschuh, a pulmonologist and pulmonary critical care here at Trident Medical Center, to tell us all about it. Thank you for being here, starting with what is COPD?
COPD stands for chronic obstructive pulmonary disease, and it typically encounters two specific diagnoses: emphysema or chronic bronchitis. You can also have asthmatic overlap syndromes with that as well.
What are the symptoms of patients that have COPD?
Typically, the most common would be shortness of breath with exertional activities. Also, you have a chronic cough and produce lots of mucus typically in the mornings.
What causes it?
Cigarette smoking causes it, although globally, biomass exposure is the most common cause of COPD.
So when a patient comes in and you determine they have COPD, what's next?
Smoking cessation is number one, followed by taking medications to try and improve people's lung function.
And the temperatures can have an effect on the COPD. Tell us about that.
Typically, most patients like cooler temperatures because we have less humidity. Less humidity, it's easier to breathe. Also, typically in the cooler months, especially here locally, our ambient air pollution isn't as bad. So people tend to do better with cooler, drier weather.
Okay. Thank you for telling us all about that, and thank you for being here for this segment of Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.